Hall, and I'm the Interim Director for the Toronto Central North Regional Cancer Program. I'm also co-chair for the Odette Cancer Center's Patient, Family, and Advisory Committee alongside Stephanie Michelson, our Ops Director, and Carol Scaini, who's on the call today. And so today's session that you're joining is called Patient as Partners, How Patient Voices Are Changing Education, Research, and Care Delivery. And this is a really meaningful topic because at the heart of cancer care, there are patient and family experiences that extend far beyond diagnosis and treatment. And it's the patients and caregivers that are really why we're here, why we're doing what we're doing. But they do see the system differently than how we're providing it or how we design it. And so oftentimes they might notice what feels clear, what feels confusing, what feels compassionate, and they also notice where there are opportunities to do better, which is why we're here today, because we would love to show examples of how we've incorporated the patient voice into the work that we're doing when it comes to designing and delivering care to ultimately improve the patient experience. So just to give you a sense of how we'll be spending the hour today, it's meant to be interactive. You'll be hearing from some of our patient and caregiver partners who have joined us today. So maybe a wave of hands for those of you on the call. We have Carol Scaini, who's our co-chair in purple. We have Moir, who's also here, and Manjula, Venkat, Ganesh, our third patient partner. So you'll be hearing from each of them. They'll be sharing their experience in our Odette Cancer Center, but also their experience on PFAC and how they've helped inform many project and great work here across the organization. You'll also be hearing from some of our clinical and program leaders who are on the call with us today. So we have Bridgette Hales, Dr. Karen Fergus, and Tamara Harth. If you guys are on the call, maybe give a wave so people can see you. And they'll be sharing some very important and meaningful work that they've been leading over the last year or so as well. So we're trying to link together patient stories and how they've ultimately impact how care is changing here at Odette. And then lastly, to say we do want this to be engaging and interactive. So we've organized a couple Mentimeter exercises to get you warmed up and involved. So for those of you who have participated in Mentimeter before, you will need your phone. So hopefully you have your cell phone nearby. And when I call upon you to do so, you just scan a QR code and some questions will pop up for you to answer. So it's meant to be fun. There's no right or wrong answers. So when we get there, I will cue you. So right before we dive into really the stars of the show, just want to give you a bit of some background on PFAC, why we're here and why it matters. And so at its core, PFAC is really a formal partnership between patients, caregivers, and the Cancer Center. It's really about creating a space where people's lived experiences can directly inform how we're designing and improving care. What makes it unique, though, is that they're not just participating as storytellers and recipients of care, they are truly partners. So they're bringing their perspectives to strengthen our clinical practice, our operations, our communication, our education, our research, and overall the patient experience. So for clinicians, for the clinicians on the call, this might look like identifying gaps in communication, or helping improve patient education materials, or highlighting those barriers patients are facing when navigating treatment or follow-up care. On the operational side, PFAC can help us rethink our processes, access, transitions in care, or even how information is shared across the system. And so, like I mentioned before, what makes sense to us operationally can often feel very different from a patient perspective. And so having their input really helps us to design better solutions. So over the last year, many of our PFAC members, and especially those on the call, have participated in conferences, committees, focus groups, strategic planning, even QI improvements across Odette and Sunnybrook to really help make our work feel more practical, more impactful, and more compassionate as well. So our PFAC, some of you might know this, but our PFAC has actually been in place at Sunnybrook for over 10 years. It's the longest standing PFAC across the organization. And so with that, we're often looked to as a leader. Other PFACs look to us for guidance around structure, engagement, how to implement PFAC. And what we did is over the last couple of years, we went through an exercise to refresh our mission, vision, value that you see on the screen, just to ensure that it continues to resonate with some of the newer members that we're seeing and the type of work that we're continuing to advance together. So today, as of now, PFAC includes 17 members. You can see the split at the bottom. It's roughly even between patients and caregivers, but this balance is really important because caregivers often bring a different lens around navigation, communication, and support as well outside of our hospital walls. And so for us, again, like I said, this is more of a partnership with our PFAC. We don't want PFAC to work in isolation. So oftentimes we meet bi-monthly, so every other month. We invite guests from Odette to come and provide updates on initiatives, priorities, and we use our PFAC members to provide that feedback, perspectives, and updates on the work that they're involved in again. So it's really that two-way dialogue that makes this partnership meaningful. So with that, I'm going to take a pause because I would love to hear from you. This is a bit of a warm-up exercise. Like I mentioned, for those of you who are familiar with Mentimeter, you could pull out your phone and scan the QR code and a survey will pop up. And then for those of you who prefer to use your computer, feel free to join us on menti.com, and there's a code here that you can enter. So I'll give you a couple seconds to join us. Again, no right or wrong answers. It's just an opportunity for us to connect and hear from you a little bit. And in the meantime, I'll change screens. So just maybe if someone can give me a thumbs up. Did you see the change of screen? Are you looking at something different? Okay. And maybe another thumbs up where you can come off mute. Are you able to access the Mentimeter on your phone or computer? I'm seeing some thumbs. Fabulous. Okay. So this is a softball question just to get our juices flowing. Would love to hear from you. What do you think matters most to the patients during their cancer journey? And feel free to type in as many responses as you'd like. There's no limit. You're starting to see them coming in. So we're seeing themes like person-centered care, feeling heard, respect, compassion, access, timely appointments, speed. There's definitely a theme around timeliness to care, high quality care, empathy. This is great. I love the engagement. Thanks, you guys. And what you'll notice is as you're entering responses and you're seeing all these words populate on the screen, some are larger than others. And what that means is that multiple of you or many of you have entered in the word compassion or access. So the larger the word gets, it means the more folks are entering in that response. So you can see some themes there as well. So information, education, safety, parking costs. Yes, we know that's a big one here at Sunnybrook. No pain, absolutely. Options is a big one, and discussing options with our patients. The feeling that they're not alone, absolutely, so that we're here for them as a team, that they have someone to contact if they're ever feeling like they have questions, worried. Clear communication is another big one. I'll give a moment for a couple other options. Cutting edge treatment, absolutely. For those of you who work here at Sunnybrook, you know we're investing a lot into our technology and innovations as well. And innovation can mean more than technology or IT, but it looks at our models of care, how we do differently with what we have as well. Support and coordinated care. This is great. Thank you, guys. So what I'll do is I'll pause here and move to the next question because I'd love to hear from you how confident you are that your answers reflects what a patient would say. So given all the responses that you put in, are you very confident, somewhat confident, not very confident, unsure? Is this based off of conversations you're having with patients one-on-one, what you're hearing in the hallways or the clinic rooms? Is this anecdotal information? Okay, so we're seeing a lot of somewhat confident, which is good. Hopefully that means that you've been hearing that firsthand from patients. And hopefully, especially if you're staff here at Odette, you feel like you've had a way to advocate on behalf of those patients or share some of those concerns at a table, like a program council or disease site meetings. We have a few that are very confident as well, and a couple that are unsure. So this was a really great first icebreaker, because what we'll do now is you'll be hearing from some of our patients as part of what we're calling a patient spotlight series. And you'll be hearing a bit about their journey, about their experience, but also what's most important to them. So thank you again, you guys, for engaging in that. And what I'll do is I'll pop back up our presentation. And I will also invite our first spotlight speaker, Carol Scaini, again, who's our co-chair for today. And just want to introduce her because it's been amazing working with her over the last few months, co-chairing PFAC together. She's played such an important role in shaping the direction of our PFAC, but also the conversations that we're having. And she brings a thoughtfulness, compassion, insight, and advocacy to this work, which has been fantastic to watch her grow into this role. So glad you can be here today, Carol. I'll hand it over to you.
Thank you so much. Wow, I'm humbled to be here. So my name is Carol Scaini. I am both a patient and a caregiver at Sunnybrook. And I really want to begin by acknowledging just how grateful our family is for everything this hospital has done for us. 10 years ago, my brother-in-law suffered a brain aneurysm, and Sunnybrook was the only hospital that agreed to take him when Mackenzie Health was calling around for support. He is alive today because of the specialists who work here. My dad was a patient in almost every department at Sunnybrook, literally, Odette, urology, cardiac, and infectious disease. We are so thankful for the many specialists who cared for him. And for myself, my cancer journey began in December of 2015. I was 44 years old with no family history of breast cancer when I found a lump in my breast. My family doctor sent me right away for an ultrasound, and I was referred to the Odette Breast Cancer Center. I still remember sitting there, heart racing, when my first nurse, Laverne, reached out and held my hand under the warm blanket during my biopsy. That simple, kind gesture told me everything I needed to know, that no matter what the result, I would be in good hands at Sunnybrook. My surgeon, Dr. Holloway, patiently answered every one of my million questions, and I mean million questions. My oncologist, Dr. Trudeau, whose knowledge and calm demeanor and humor made the next steps feel doable. She was someone I trusted with my life, literally. She was followed by an outstanding chemotherapy team, radiation treatment under Dr. Vesprini, and Dr. Patini, who performed additional surgeries. What an incredible team, one I came to call my family. I'm so thankful for the genuine care that each member of those teams showed me, from taking time at appointments to listen to my highs and lows, to follow-up calls just to check in. I was always treated as a family member, which gave me great comfort and peace through it all. While waiting for an appointment in those early days, I noticed a sign on the wall about joining the Odette Patient and Family Advisory Council. And I thought, what a wonderful way to give back as a thank you to everyone who cared for me. I became a PFAC member shortly after my treatments ended. And here I am, a whole bunch of years later, serving as co-chair. Our PFAC team primarily partners with the Odette team, but we also work across Sunnybrook to provide insight and feedback on initiatives that improve care. The best part is seeing our ideas come to life and working alongside patients, caregivers, and staff who are equally passionate about making this place better. Let me share 3 areas where I've been fortunate to contribute. An email came through to our PFAC team looking for individuals who could improve patient experiences in the emergency department. I immediately thought of the many times I lived in the emergency department with my dad. While we sat waiting to be called in, I saw countless people walk in, completely stressed out, looking so confused as to where to begin. I suggested adding large numbered signs, number 1 for the self-check-in kiosk, number 2 for the waiting area, and number 3 for the triage nurse. Last year, I was cleaning up some bushes and trees, and my eyeball unfortunately got kissed by a tree branch on the weekend. I made my way to the emergency department to make sure all was okay, and I was so humbled to see that my simple suggestion was implemented. I witnessed firsthand that patients were able to navigate through the emergency room with better ease. My second involvement, the Sunnybrook to Home program, helps patients transition from hospital to home with the supports they need. Since launching in 2024, it has successfully transitioned over 700 patients. As a caregiver who navigated Ontario Health at Home and the North York Reactivation Care Center, formerly Humber Hospital, with my dad, I can offer real-world perspective. And I'm especially excited about the potential to include cancer patients so the recovery can be monitored at home rather than requiring repeated hospital visits. The final committee is a Project Reach initiative, which is transforming and modernizing Sunnybrook's clinical systems with a new unified health information platform. I was honored to sit alongside top professionals, listen to company presentations, and ask questions through a patient and caregiver lens. Things like, can we book and change appointments online? Can we access our own test results, connect with medical staff, access accurate health information instead of just using Dr. Google? It also allowed us the opportunity to dream. Wouldn't it be lovely, I asked, to be able to know when my dad will be seen in the emergency department by text message? A tracking sort of system so I know whether I can leave my dad for a minute to go to the washroom or grab a tea instead of bothering the staff who are already quite busy supporting patients to find out where I am in the line. These may seem like small wishes, but to a caregiver or patient, they make an enormous difference. As co-chair of the Odette PFAC team, it warms my heart that our thoughts and views are valued, appreciated, and applauded, and that we are considered part of this wonderful Sunnybrook family. I began this journey as a caregiver and a patient who was cared for, and I am grateful every day to now be in a position to help care for others in return. Thank you so much for allowing me to speak today.
And thank you, Carol. This is the third time I've heard you speak, and I learn something new every time. So just want to thank you for making your time to share your experience with us today. And I'm sure lots around the table have learned from you as well.
Thank you
So with that, one of Carol's examples, she mentioned her involvement in the Sunnybrook to Home program, and we thought it might be nice to invite someone running that program. Bridgette Hales is with us today. She's Director of Community Integration and Outpatient Transformation, just to share a little bit about what was that opportunity? How did that even come about? How did they use the voice of PFAC to inform the work, and what was the outcome or the impact? So with that, Bridgette, welcome. I'll hand it over to you.
Thank you very much, Rachelle, and thank you to Carol for introducing the topic. So it's a pleasure to be able to share a little bit about the Sunnybrook to Home program and how patient and family voices help to design it from the get-go. So I will say a lot of this work happened before my time, even in this role, but I have had the pleasure of working with Carol and one other patient partner to keep refining our program. So maybe for those who don't know, the Sunnybrook to Home program is it's a 16-week bundle of home care services that are meant to help support patients when they are at their highest, most vulnerable period of time at the point of a discharge from hospital, transitioning back into the community to provide them with the services they need to make sure that that's a smooth transition. And then they can, end their time with the program or be transitioned to longer term services with home care supports like Ontario Health at Home. And so the reason for the development or the opportunity, the problem we were trying to solve with that program was really to help support those transitions and to try to reduce the number of patients who were waiting in hospital for appropriate supports to care for them in the home. And so we had a working group made up of clinical services across the hospital, the community integration portfolio, which I am part of, our home care provider partners, and a lot of our community support service partners, and Carol and one other patient partner who came to help inform what that period of transition looks like and what the key pieces of a program would need to be put in place from their perspective to make it successful. And then, as Carol said, we've seen several hundred patients since the inception of the program, but we've also just recently gone through a process to reestablish contracts with our home care providers. And we were very lucky to have Carol be part of that table and help inform the kinds of questions that we really needed to ask these home care service providers that were competing for to be part of the Sunnybrook to Home program. And so I really think that it added a layer of richness and thoughtfulness to the questions that we asked in the presentations, in the pitches, and in the reference checks afterwards to have the patient voice and the family caregiver voice represented. So we implemented, the change was that we implemented this program in June 2024. We've seen over 800 patients now, actually. And we've been able to really make sure that we've got patient-focused processes as part of the operations, a 24/7 call line, and the patient consent processes that we follow to enroll people in the program have been informed and edited by the patient partners to make sure the lens was there. And our program continues on. We have the people who enroll in this program tend to have a shorter length of stay in hospital. They have faster access to home services than people who are discharged home with traditional home care service. They tend to have fewer ED revisits within the first week. And in terms of capturing the patient perspective, 100% of the people that are surveyed for their experience with the program expressed satisfaction with the program. So we're very grateful. We've got a couple quotes here on the right about what our patients have to say in the program, but we certainly have heard their satisfaction with the program and the real need to make sure that we keep enhancing it with other aspects that meet their needs. So thanks for the opportunity to share.
Thanks, Bridgette. Appreciate you being here. Such an amazing program for our patients and very patient-centered. It's actually sparked a lot of ideas to the point where we're considering something similar here at the Odette Cancer Center. So happy to kind of look to you as leaders and figure out how we can make that work for patients here at Odette. So with that, I'm going to move to our second patient spotlight and invite Manjula, Venkat, Ganesh. Manjula has also been an incredible patient partner here at our Odette PFAC by offering a really unique perspective, but she's also known for her patient partnership work at Scarborough Health Network, which is one of our partners here within Toronto Central Region. And what that does is give her really great insight around meaningful patient engagement and what that could look like across different care settings and organization. So Manjula, glad to have you here. Welcome. I'll hand it over to you.
Thank you for the opportunity and for the great introduction, Rachelle. It's very generous. Good morning, everyone. It's afternoon, sorry, good afternoon. So my name is Manjula Venkat Ganesh, and a management accountant by profession. So today I have the privilege of sharing my story with you all. 2011, we migrated to Canada, and I was working with one of the top corporates in Toronto, but I left to join my husband in New Brunswick, where he had taken up a job. And 2017, we shifted back to Toronto when I got a job transfer towards the end of May for better career prospects. And one day in August, when I was taking a shower, noticed a lump in my right breast. And as soon as we got a family doctor, mentioned this to her, and on physical examination, she knew exactly what the lump was. And what followed was an urgent referral to a surgeon at the breast clinic at Scarborough Health, who ordered a series of tests, biopsy, CT, MR, everything. And within a few weeks, I underwent a mastectomy of my right breast at Essachin. We were devastated as we had had a child after 2 miscarriages and 13 years of marriage. I breastfed her for almost 2 years. I'm a non-smoker, and there was no prior history of breast cancer in the family. My daughter was 9 years old, and how are we going to cope with this, and whether I would live to take care of her was a big question. Drains, stitches, pain, fatigue, and more, both physically and mentally. It was very exhausting. And once the drain stopped, which took quite a while, I met my oncologist, Dr. Paul Lau at SHN. Biopsy results of the surgery was in, and I was diagnosed with triple-negative breast cancer. And chemotherapy sessions started soon thereafter for 5 months every week. and I was fully exhausted by end of it. But during the chemotherapy sessions, support from my oncologist and team who encouraged me to do every activity within the guidelines and while taking care of myself so I don't move the PIC line. Nurses, caregivers, my family, they were all very supportive. And after the treatment, I was back within 6 months on a gradual return to work and have managed to hold on in a corporate environment, though I did not have the courage to take a more demanding role as I prioritized being there for my family, cooking a meal, spending time with them. Now, my daughter just turned 18, and maybe I'll look at the possibility of pursuing my career again for a higher role somewhere. I had invited my mom as I lost my dad the year before. So now she became my caregiver and she took care of my family and myself during my treatment and recovery. And one day she complained of trouble swallowing. And a couple of visits to the emergency and admission thereafter, she was diagnosed with stage 4 esophageal cancer. And now the roles reversed. I became her caretaker. I lost her in February 22. She was taken very good care of by both SHN and Sunnybrook Health Sciences, where she passed away in palliative care in Sunnybrook. I'm forever grateful to Odette Cancer Center, the ICU team, palliative care, oncologist Dr. Rang, Dr. Jordan at the ICU, Dr. Bennett at palliative care, and various other doctors whose names I could be missing. Before my mother passed, I became a PFAC member at Odette Cancer Center in January 22, wanted to give back, wanted to help, and wanted to say a million thank you to everyone, the oncologists, nurses, caregivers, and staff. In 2023, became a member of the corporate PFAC at SHN, and in 25, joined the palliative care and now a co-chair at Oncology PFAC at SHN, Scarborough Health. And me and my family will ever be grateful for all the doctors, oncologists, surgeons, doctors, caregivers, nurses, and staff who took care of me and my mother. And my whole family is now a volunteer at Scarborough Health. And wanted to share a couple of projects among various that I have had the absolute privilege of being part of in Sunnybrook Health Sciences. I worked on the first patient experience acceleration fund selection committee project, reviewing proposals for grants and giving recommendation for fund allocation. And this project was led by Dr. Monica and Dr. Law. And currently working on the insomnia project for cancer patients, which is a great initiative being spearheaded by Dr. Karen Fergus. This project resonates with me as I had undergone through many nights of insomnia during and after my treatment. So I'm very grateful for getting an opportunity to share my experiences with the research team and contribute my small bit to this great project. It'll be amazing for patients when this takes off and they'll reap the benefits with communicating and sharing their concerns with experts who will offer the program to them. Thank you for all your efforts in making patient experience the best in Sunnybrook Health Sciences and Odette Cancer, and want to express my deepest gratitude for this opportunity today to share my story with all the esteemed guests today and participating in this amazing session. If I can, everybody can. This is my slogan. Have a wonderful day, and thank you for the opportunity. And I'll hand it over to Dr. Karen.
Thank you, Manjula. So much appreciate you sharing your story and honestly the advocacy work that you're doing at Sunnybrook, but also Scarborough Health. You're a very active community member and we appreciate your voice at our tables as well.
My privilege. Thank you.
So with that, I'd love to invite Dr. Karen Fergus to the table. She's a psychologist here at Odette on our patient and family support team, and she's also our psychosocial oncology regional lead here at Toronto Central North. So with that, I'll hand it over to you, Karen.
Let me just unmute. Thank you so much, Rachelle, and also Manjula, for your kind words. So I'm going to be speaking to the value of engaging PFAC members in research. This is also known as patient and family partners in research. And it's really great to be following you, Manjula, in this regard, because your contributions have been incredible and so invaluable to us. And I should also mention that in addition to being a clinician and PSO lead, I'm also a researcher. So hence why I have a strong interest in working with our PFAC members in research. And one of our main research endeavors at the moment, as Manjula was just saying, is a quality improvement project to improve the sleep of our patients and specifically to help those with insomnia disorder. And actually, insomnia disorder is a very serious concern affecting between 30 and 60% of our patients from diagnosis through to survivorship. Now, just over a year ago, Ontario Health released what they call the quality standard, stipulating that psychosocial intervention called cognitive behavioral therapy, or CBTI, will be and is the gold standard for treating insomnia, not medications like sedatives and hypnotics. And in fact, anecdotally, we hear that many patients would prefer not to take pharmaceuticals to improve their sleep quality. However, at present, CBTI and its derivatives is not widely available to our patients. And so the first step of our QI and research project has been, as you can see here in the second bullet, to develop the insomnia treatment preferences survey. And in addition to that, so in order to actually survey our patients and to see, what types of therapies and treatments are they wanting and interested in, and also to develop a grant proposal to get funding to support this research. And so those were some of the opportunities that we encountered. And then, over here, this image is with me. You'll see Tamara Harth will be speaking momentarily, is another member of our research team. And to my right there is Dr. Nicole Carmona, who is co-leading this project with me and is a psychologist as well, and our resident insomnia expert. And then you'll also see, some of you may know Trina Buick, who is a researcher in nursing as well and has a strong interest in insomnia care. So that's what I think of as the knowledge experts on our team. But we also have major contributions from our team, from our PFAC members. And in addition to Manjula, and that's that little Zoom meeting there, you'll see a screenshot of us there. Meeting with Manjula, as well as UV Sharma and Miyabi Nauzati, who are also our PFAC members on this team. So in terms of their contributions so far, first of all, I just have to say those early conversations with yourself, Manjula, and Yuvraj and Miyabi were just so informative and illuminating because of the range of experiences that many of you bring, both as caregivers and as patients. And these insights really helped to deepen my and Nicole's understanding of our phenomenon greatly. And from there, you actually helped us drafted a letter of support for the proposal that we submitted to the Ontario OICR, Ontario Institute for Cancer Research. And more recently, you've helped us refine that survey as well, and basically make that survey as user-friendly in terms of reducing the time and burden to our patients and increasing the clarity of the language, and also therefore the accessibility of the survey for all English-speaking patients. And even more recently than that, at that meeting that I grabbed a screenshot of, we were actually reviewing some preliminary survey data, and just with about 20 patients we had at the time. Some of you may have seen some of our advertisements on the monitors in the waiting areas for this survey. And just getting that ball rolling with a little bit of conversation around what are our preliminary findings showing us, maybe some of those early kind of potential implications of that. So that's been really useful. And then in terms of impact, so in the near term, first of all, we were successful in getting this grant last year. So thank you to everyone who supported that project and that proposal. And also, in terms of the modifications to the survey itself, giving patients a voice in the type of care that they need at every treatment stage. Our mission is to get the right insomnia treatment, helping our patients access the right insomnia treatment at the right time. And in the long term, what we're hoping to do is this little wheel that you see on the right of the screen, lower right there, is to create what we're thinking of as a virtual insomnia hub with accessible resources to manage and treat insomnia in our patients. And just if you sort of progress from left to right, it's kind of like, and in a clockwise way, it's sort of like a stepped care approach that we're hoping to see, which is beginning with helping our patients understand those symptoms. Like, are they suffering from insomnia? Just a little bit of an early gauge for yourself. How do you evaluate your own sleep distress, as well as providing sleep education, and followed by relaxation training and resources. So there'll be links to resources to help with calming the central nervous system and preparing for sleep. And then in that lower half of our hub here, there's a progression in intensity in terms of CBTI resources. So from self-management resources and workbooks that we'll be vetting and recommending, all the way through to offering virtual and possibly in-person group support for insomnia care, and then leading to the most intensive for patients that need a more tailored approach. So that would be cognitive behavioral therapy one-on-one to help treat your particular insomnia disturbance. So that's the vision, but it all began with collaborating with our PFAC members and starting to get that wheel turning, let's say. So thank you very much for the opportunity to share, and yeah, happy to be here.
That's great. Thank you, Dr. Fergus. Really great example of taking research and turning it into something impactful and practical for our patients to help improve their care. Okay, beautiful. So with that, we'll go to our third and last patient spotlight with Bev Moir. Bev's been incredibly engaged and passionate in this work, not just at Odette, but outside of the Odette walls as well. She's very much connected to community work and continues to bring her lived experience and unique perspective to our conversation. So welcome, Bev. Thank you for being here. I'll hand it over to you.
Thank you so much, Rachelle. I'm really pleased and honored, as the others have mentioned, to participate. So I will just share a little bit about my experience. And I was told on July 29th, 2019, that I had stage 4 lung cancer. And the resident who told me my diagnosis told me it was going to kill me. And it was really a shock. I suspect I might have been her first patient that she was delivering this type of news to. But for somebody who was very healthy and never smoked, it came as quite a shock. I wasn't part of Sunnybrook per se, or the Odette Cancer Center per se at this particular time. I was referred into the hospital through the Cancer Care Ontario Diagnostic and Lung Assessment Clinic. When I did get referred to the Odette Cancer Center and to the clinic, I had an excellent oncologist who very compassionately interpreted my diagnosis, told me to expect to live 6 months to 3 years, get my affairs in order. But it was just delivered in such a wonderful way. We could swallow it, and we could take action because of it, which was really helpful. It sounds pretty severe, but based on my pathology and the state of lung cancer at the time, it was harsh, but it was realistic. So it was a message that we had to receive. Thankfully, biomarker testing showed that I had an actionable tumor. And despite a healthcare background, I've had very little exposure to oncology. And I couldn't understand why people were smiling when they were telling me that I had an actionable tumor. I eventually learned it. It meant that I was able to get targeted therapy, and I'm coming up to my 7-year anniversary. So you can see that having an actionable tumor has been very, very helpful. I've also had radiation therapy for 3 lung nodules. It was a successful procedure. I learned a lot in the process, but at the time, my radiation oncologist said, I'm going to try and give you maybe 10 more months before there's more disease progression, and I ended up getting 2 years. So he underpromised and over-delivered. So how's that for delivery? I did eventually develop resistance to the first line of therapy I'm on. I'm now on my second line of therapy, amivantamab and pemetrexed. It's a little harder to take, but I would say that, excuse me, my healthcare background and nursing background has actually been very helpful in terms of managing symptoms. And I talk to a lot of fellow patients in terms of how they've experienced this line of therapy and how they're managing or not managing the side effects. And I found that that's very, very helpful. And it's where I feel very passionately that as a patient and member of PFAC, we can share our experiences and be of help. It's definitely been a new experience for my husband and I to spend so much time in the hospital, let alone the chemo unit. It is also a busy place, but I've been very, very impressed with the chemo nurses, watching them in action and seeing how empowered they are. And just as a little antidote, one day I was in the chemo unit, still early in my exposure to this line of therapy. My husband was there, and his adult son came by to visit. And somebody in the bed across from me looked like she was about to have a cardiac arrest. And I thought, excuse me, oh my gosh, I have a healthcare background. I used to be a head nurse of a coronary care unit, but I thought my husband and his son are going to be shocked, and I was going to have to jump out of my bed to take care of them. Anyway, the nurses really handled that situation very, very well. And it's just a very impressive unit. And I would just say the Odette Cancer Center, just generally, it is jam-packed with people like me. And the demographics, there's just more and more of us arriving. And I'm just very, very impressed with how well it works, like a well-oiled machine. So overall, my treatment and my care has been excellent. I feel that everybody I've interacted with has been very knowledgeable. They've been very competent. They've been very professional. And I felt that they've had my best interests at heart. And just an example of that, I was not asking for a second opinion when a clinical trial was offered to me. And I'm pretty proactive in my care, but my practitioners were offering this to me. And I can tell you that I talk with a lot of fellow lung cancer patients who might want a second opinion, and they're intimidated to, and not necessarily patients at Sunnybrook. They might want a second opinion and they feel intimidated to ask, or they've asked and they've been rebuffed. So I feel that Sunnybrook is a very special place. Since I joined PFAC, 2 areas that I participated in, which I found very, very helpful and very meaningful to contribute. I was a patient voice at the strategic planning process for the Odette Cancer Center, and I was very, very encouraged with what I was hearing from Dr. Fergus and others in terms of the opportunity for the patient voice. I think we can help read documents and make them more readable for patients. I think we can help build trust in the process of participating in research or a clinical trial. And I was very glad to share my experience and some of the things I learned when I had the stereotactic radiation. at the recent Florence Weinberg patient and family session. So something that I would like all of the clinicians to be aware of is that we want to give back. Anybody who volunteers to be part of PFAC wants to contribute and share what we've learned with fellow patients and help to improve the system. So please use us. I also think that we have a good opportunity to be involved, not just in operational issues, but interacting with fellow patients in terms of strategies for dealing with side effects and just navigating the system. And it's intimidating for patients. And I think having already experienced and tasted what Sunnybrook and Odette has to offer is something that we can share with other patients and be of assistance to them. So thank you very much. And I'm pleased to have had a chance to share my voice.
Thanks so much, Bev. And you're totally right. Those of you may or may not know, but here at the Odette Cancer Center, we see 10,000 new patients every year. So it is growing, and our teams work very hard to ensure that every new patient doesn't feel like another number. But it is important that we use our PFAC to help inform that patient experience. So you would have heard Bev speak about the Winberg series, which we invite our patient partners to help educate other patients. And so with that, just to learn a bit more, we've invited Tamara Harth, who's our manager of patient experience and education, to talk a little bit more about that process and how we involve our PFAC in that. So with that, Tamara, I'll hand it over to you.
Thanks, Rachelle. And thanks, Bev, so much, because I think it's a perfect segue into what I'm going to be speaking on, which is really, I would start by saying a guiding principle for patient education is really that patients are experts in their care. They come with the experience, with knowing what is going to work for them, with all sorts of other perspectives that are really important for us to take into account as specifically my team is developing education tools. So the concept of patient as educators being one that we have integrated very intentionally into patient education for many, many years now. And I will speak to this idea of how we do that in the Winberg Education Series. The Winberg Education Series has now been happening for over 2 decades, and it's evolved quite a bit from what it was. But again, the guiding principle over the last decade for us is that we want to integrate patients' voice in terms of the education that we're providing. And so for people that don't know, the series is really an opportunity for us to focus in on a specific topic. It can be disease specific, so breast cancer, lung cancer, or it can be more general in terms of treatment. And also we do quite a lot in terms of psychosocial oncology topics, because those are universally ones that people really want to hear about. But we used to do it in such a way that we had clinical experts only, and we decided quite a long time ago that we were missing that voice and that perspective from patients. And so we developed this program called Patient as Educator. So from a PFAC perspective, it's been incredibly helpful for us because we have really a diverse group of people that have had various experiences and come with different perspective. And so we sought Patient as Teacher from the Odette PFAC for the Winberg Education Series, and many of you have contributed to that series. It is a guiding principle. It's a standardized inclusion of the patient caregiver perspective in any series that we do. And Bev was generous enough with her time and was able to, and you heard Bev speak about the idea of navigation and one-on-one with patients and families, and having that opportunity to speak directly to them about, in this case, the experience of radiation therapy. This is something, again, that we see back because we do a lot of, every single time we offer the session, we have a poll, and we have a very high completion rate on that poll, which is a survey. And we ask specifically about Patient as Educator and what was the experience. And what we hear back is it decreased my anxiety. It helped validate the experience. It provided me with tools and tips that I had not yet known about. And you can see that one of the things Bev referenced was that she was not able to read those education materials or those resources, so too rushed with having to stop her other treatment before starting radiation. And looking back, taking time to read them would have helped her prepare them for radiation treatment. So that gives us a lot of information from two sides. One is the patient is the educator in terms of the team. So perhaps us taking that into account and thinking about different strategies and ways that we can ask the team to provide education, not so much that it's on their time, but it's a strategy we can develop in terms of what's going to work for the patient who's receiving that education, and also encouraging patients in a very, again, intentional way to take the time to sort of read or to watch a video or to learn more about all the resources we have. And by the way, we have a very robust patient education webpage with all of these things on it. And again, helping them understand that this can decrease anxiety, help them become more informed, understand who they need to go to for things like side effect and symptom management, etc. So what I would say the change has been is that it's a really formal, intentional acknowledgement and integration of patient or caregiver, family, friends, lived experience in the context of education. And most recently, just to give you an example of what that change looked like and what the impact was, is that we had 166 participants that attended the live webinar, which is very typical attendance. Often we'll have in excess of that. It was then recorded and it's emailed to 250 plus patients. It's then edited and saved on our website as a place that people can go to hear about that specific cancer experience, in this case by Bev. And again, the data we get back from a qualitative perspective is very supportive and tells us that this is a very critical part of learning about a cancer type, a treatment, side effect, or symptom management. So we will continue to do these series. We run them every 6-ish weeks. And the relationship that we have with PFAC to pull from that pool in terms of patient as educator has been an extremely important one to keep this work alive. So thank you very much, Bev, for your recent participation in our series.
And thank you, Tamara. That was great. So these are just 3 of over 25 examples and initiatives that our PFAC has engaged in. So a lot of work, as Bev mentioned, they're a very hungry group. They're willing to engage and provide feedback. But we would love to hear from you all again. So for those of you who are still on the call, feel free to join us on Mentimeter because we have a couple questions. Hopefully these presentations got your wheels turning around how you can involve PFAC or the patient voice in the work that you're doing. Because we would love to provide that opportunity to connect you. So hopefully you're still on, because we'd love to learn from you, where could the patient input most improve your work? So was it designing new initiatives or programs, improving education materials? Is it identifying gaps in care, evaluating existing services, or supporting difficult or complex decisions? So I'll just give you all a moment. This is really helpful information for us to take back to PFAC as well, because it helps direct our work. But I'm seeing a lot of engagement, particularly around identifying gaps in care experience, and then also designing new initiatives and programs and improving education materials, or even evaluating existing services. So let's go. A couple more responses. Yep, this is great. So then this question here, you might have a project or an idea at the tip of your tongue or on your mind. Would love to hear from you, and you can just enter via free text. What is that one project idea or challenge where PFAC input could be helpful? So again, anything that comes to mind, it could be existing work, could be future work. It could even be past work that you said, you know what, it might be nice to get some input on how we can improve this. Care path timing. Okay. So looking at looking at pathways, so designing the future cancer care at home pathway. Yep. New patient portal is a big one for everyone involved in patient in Project Reach. Pharmacy department, how can we improve the patient experience? Yes. Phone lines, peer support, prioritizing care gaps, patient involvement in clinical trials, complex patients, and looking at care for complex patients. These are really great examples. Phone lines has popped up again. Great. And peer support. This is beautiful because now would love to share with you, and I see some navigation of resources or geography. It's a very complex system that we work within, so can only imagine for those of us in the healthcare system still learning how difficult it is for patients and their families to navigate as well. So great ones. And if I scroll down, there's some additional ideas here as well. So that's fabulous. Feel free to continue populating that in. What I would love to share with you next is how to contact us or get in touch with PFAC. So if you have an idea that you really want to move forward with and you would love input from PFAC, we actually do have a PFAC engagement request form that you can fill out. It's not overly cumbersome. It's just some contact information and a brief description around the engagement or type of project that you're working on. And what we do with this is we share it out to our PFAC network. So we can do one of two things. If you're hosting a focus group, we put out a call and we see what PFAC members are available to participate in an engagement session. Or we can even invite you to one of our PFAC meetings where you can come and give a presentation and get feedback from the whole PFAC group, which you saw we have about 17 members right now. So this is one way to get in contact with us. And the other way is to connect or email with Anoja Selvaraja, who's also here on the call. She's our program coordinator and helps support our PFAC. She's fabulous. She also helped to coordinate today's session. So thank you, Anoja, because this was a heavy lift and lots of people to coordinate. But you can also contact her if you would like to get in touch with us or with our PFAC as well. So with that, I just want to pause. That brings us to the end of our presentation. And would love to end with a collage of all of our lovely PFAC members who I have the pleasure of seeing every other month. They're, as we mentioned, very much engaged, and you heard from a few of them today. So again, thank you to all of our PFAC members and our program leaders who presented today. Just want to thank you for your time and happy to open it up to any questions if there are any. Monica?
I know we're almost out of time. I just wanted to say a big thank you to all the presenters, especially to Manjula, Carol, and Bev for sharing your stories. I know it's not easy in front of some strangers, but also for all of the hard work that you've been doing over the last, couple of years that I've had an opportunity to get to know you and contribute to the program. We can't really deliver care services to patients without having the patient voice included in all of that work. So I just wanted to really express my gratitude to all of you for all the work that you do. We have lots of plans going ahead. So one of the questions that I have for you in the last minute, and maybe we'll take it offline and continue at PFAC, is, we have a very ambitious strategy for the program looking ahead, and many of the initiatives would benefit from having patient engagement in different roles, like sometimes more to validate the findings, but oftentimes actually in much more active co-design kind of function. So just sort of, I realize you're also busy people or busy patients. How can we utilize your input without overburdening our patient partners? Because this is all volunteer, right? So I don't know if you have any thoughts in the last minute, or we can continue at PFAC. I was the one that put the prioritization in there because trying to figure out how do we use these wonderful group of individuals that have been so helpful to our program in the best possible way.
Thank you, Monica. And happy to open it up to Bev, Manjula, Carol, if you have any immediate thoughts on that. But if not, happy to take that offline too.
I think to be honest, it's just a bonus when an email comes through. We get all excited. Here's an opportunity to do something. And we kind of look at the timeline and I think we all kind of make our own decisions of whether we can take it on or not. We have spoken about the fact that, now that maybe some of us are retired, it gives us a better opportunity to come during the day to help with things, or even after hours, or just being involved online helps, or maybe even reviewing things and providing an email back. So the more options of maybe giving feedback, or the more options that are out there, we all kind of make it work or make it happen. But yeah, we definitely would love more and more people to be part of it.
Thanks, Carol. Manjula?
Thank you for all the kind words, Dr. Monica. And every time there is a project that is sent out, the people handling the project are so kind to give different time slots to check about our times, which is so helpful. They don't take us for granted. Like, there are so many time slots given, and then we can choose, and then they decide on that, which is really helpful. And so privileged to participate in various projects. Thank you so much for the opportunity.
Thanks, Manjula. I'll leave the last word to Bev.
Thank you very much. The committee, the PFAC committee is large, and it obviously can't be unlimited, but we could consider maybe developing teams and people that are interested in research, people that are interested in patient education materials or navigation, and then have backup people. And then I think also technology has just facilitated a lot of it. It saves a lot of driving, and it's been a nice way to participate as well. But it truly is an honor to give back to such a wonderful institution and to other patients. So I think, Monica, you'd find many of us are motivated to do whatever we can to help.
Oh, I know you're motivated. I just don't want to be, we appreciate the time. It's,
Can't abuse us. Yeah. So maybe teams and build out extra supports.
thank you.
That's fantastic. And Monica, appreciate the question, because everyone on the call here is also learning from the responses as well around how to involve patient and caregivers in their work. So with that, I know we're a couple minutes over. Just want to say thank you to everybody, because at the height of the presentation, we had 47 participants on the call, which is a fabulous turnout, more than we had expected. So I'm hoping each of you walked away learning something new. And as always, should you need PFAC input, you know how to reach us now. So again, just want to thank all of our PFAC members for joining us today, all of our program leaders for sharing their knowledge with us as well, and all the participants for making yourselves available to learn a little bit from us. So enjoy the rest of your afternoon. Thank you, everybody.
Thank you so much for the opportunity. Bye-bye. Have a nice
Take
day.
care.
You
Bye.
too. Bye-bye.